We believe in bracing for parts that need to have the patient be reminded of directions or positions that would make healing slowed, so that there are times when a part is injured in the neck, for example, where you may have the ligaments that are stretched out as one possibility. You may have a nerve that goes down to the arm swollen because a disc is pressing on it due to the patient's posture possibly aggravating the disc and putting pressure from the disc against the nerve as it exits through a tunnel in the neck to go down the arm. And then there are times when there's swelling from inflammation. And if the part could stay in its mid-range, then that part could have a faster time of healing. We use the Philadelphia collar because rather than a soft collar that does not stop skull motion, the Philadelphia collar has a position for the chin to not rest, but guide the head to where it needs to be, so that rotation is guided to the patient to be held in mid-range rather than rotate. The Philadelphia collar comes in over 7 different sizes. In this case, I have 3 mediums, and they're all different heights depending on a person's stature. Let us just think of the actress Audrey Hepburn, who was known for her very tall, slender neck. And then there's others who might be like a person that weighs possibly 200 pounds and is a short-statured person that may be only, say, 5 feet 7 inches. In this case, the vertebrae are not tall, but in the case, they may have to have a large circumference and not be a medium, but a large, but they don't need to have the height that maybe a small Katharine Hepburn might be, but with a tall neck, whereby she might need a 5 3/4 inch high brace. In this case, teaching the patient how to use the brace is important for it to be successful. As I put the brace on, and I fit her in the clinic, I Velcro it so it is not tight, but is somewhat loose and comfortable. So I don't want it to be binding for her. And I want her chin to have room and space where it's not touching. The part that touches the sternum, I want to have a slight space. The part that touches the back of the skull, I want to have a slight space. And the part that touches the upper thoracic region, upper back, to have a slight space. By so positioning the collar in that it fits her in this manner, she's then instructed that the collar has 4 points of contact that should not be contacted. 1, 2, 3, 4. So she's instructed to notice that these 4 points are not to have any one become excessive in its pressure. If she was reading, for example, something down in front of her like this, and she felt the chin touch the cup in here, or the sternum part touching, she would know that she's moving into a range that we're asking her to avoid while things in the cervical area have a chance to heal by having the guidance of the brace given to not totally immobilize, but to guide the muscles in the neck to support the neck in this position. We don't feel that the muscles are atrophying because we have not cinched the neck upon her. She is responsible for the 4 points, not having any one become excessive. And those are her cervical muscles that are producing that kind of control.